Very good evening on behalf of Island Hospice and Healthcare, everybody who's here. Thank you so much for sparing your time and joining us. We meet this year virtually for the first time. And ordinarily, we would be at Royal Harare and having these discussions. But this year, because of what's going on in the world, we are meeting virtually. And I think so far, so good. It seems to be working. So thank you so much for registering first and foremost, and then secondly for spending this time with us. And fittingly today, our focus and area of focus, as I say, is obviously COVID-19. And there was no other way we could go because of what it has done to the world. And we're going to look at it from various perspectives. With us today are Dr. Dixon Chifamba. We've got Ratizai Moyo from Childline, and then Dr. Austin Jeans as well. So I'd like to thank the team across at Island Hospice and Healthcare, of course, ably led by Mudiwa Mundawarara, who convenes these sort of meetings every single year. Last year was phenomenal, and if you were there last year, I'm sure you enjoyed that one, and no doubt this one will be exactly the same. I think it gives me great pleasure to call upon Dr. Dixon Chifamba. He's a palliative care physician with a special interest in public health in as far as it relates to palliative medicine. He trained in Zimbabwe and did postgraduate studies in palliative medicine at the University of Cape Town in South Africa, of course. He's been involved with Island Hospice and Healthcare since 1999 in various capacities at board and executive level. And he became Island Hospice Executive Director after leaving Chitungwiza Central Hospital's medical superintendent post in 2004. In 2013, he stepped down to concentrate in palliative care, training and research on a part-time basis with Island Hospice in his role as the palliative medicine consultant. He also pioneered a private palliative care practice right here in Harare. Ladies and, no ladies, or at least we hope not, unless they're moonlighting, but certainly gentlemen, please help me welcome Dr. Dixon Chifamba of Island Hospice and Healthcare. He will be addressing the subject, gender differences in patients with COVID-19, focusing on the severity, mortality, as well as care and support. Dr. Chifamba.
Thank you very. Welcome, everyone. My topic has already been mentioned, and why did I choose this topic? It really rhymes with the focus of the discussion today, looking at this men's event. And it's quite a topical issue at the moment, the issue of COVID. There's a flurry of information coming, some of it not scientific, some of it maybe from fear, some of it from social media. So I think my presentation will put some scientific facts into perspective, and as men, we reflect. So just a brief background about what we are talking today. You know, when you look at COVID, actually, the first cases of respiratory infection and pneumonia were reported sometime in December in the city of Wuhan in China. Although from reading, they might have started seeing these symptoms of pneumonia earlier than that. But I think officially it's 31st of December. And the causative agent was this new virus called new coronavirus 2019. And it was isolated in its structure in January, early January. And through WHO, it was later termed COVID-19. This is not something new. It's not like it's a very novel virus. You know, the coronaviruses have existed since in the 1960s. And examples, you know, the Middle East Respiratory Syndrome was also an epidemic at some time. The SARS, severe acute respiratory syndrome, to which this new virus also seems to belong to some family. You know, it's incubation period. That means when you get infected, it may take up 1 to 14 days, depending on your immunity. And it's very important to note that it affects people of all ages. Whether you're old, the young, it doesn't spare. But you will find that it has got this, can I call it an affinity, especially causing more harm in the older people and those who've got comorbidities. We'll be discussing about this later. What is the route of transmission? And I'm pretty sure some of this information is quite routine to everyone. Mainly respiratory route by droplet infection. You know, when someone coughs, sneeze, or as I'm talking right now, there's no one in front of me, and that's why I'm not wearing a mask. Otherwise, I should be wearing a mask because visible to the naked eye, I'm spewing some droplets while I'm talking. So at each time you open your mouth, whether you yawn, you speak, you sing, you are spewing some. So if you've got infection, you're going to spread to someone that infection. And it can also be obtained through contact route. You know, like for example, I'm sitting here, the table. When I leave, some of the droplet infection will settle on the table or whatever objects, whether it's a cell phone or anything like that. So if someone comes and touches it, they're also going to get that infection. They touch the table, the nose is scratchy, the eyes are scratchy, or you want to pick your teeth or something like that, you are also directly introducing infection into you. Aerosol formation, this is an area of emerging controversy, and for those who follow the scientific world, when I speak about aerosol formation here, I'm speaking from the perspective of procedures. You know, like the intubation. Someone who has been very sick, when they're intubated, or someone is going to theater, there's quite a lot of suctioning and all those. That procedure creates that aerosol condition I'm talking about, like the ENT surgeons, the dentists, when they are pulling those teeth and they're doing all those other procedures. So it becomes a route of transmission. There's also other areas which have not yet been validated by science, but you never know in future, like fecal spread. What we know is the virus has been isolated in stool. I still remember a case report. Maybe it was not a scientific one, but I think one of these newspapers of a young man, I think in the States, I don't know whether it was part of this, I don't know whether it's morbid thinking or a challenge which they do to go and lick one of these toilet seats, and he got infected. But maybe it was not directly from stool, maybe it's more of the contact. Then also ventilation systems. If we've got enclosed spaces where there's no good ventilation, remember the aerosol talked about the droplet of top, they will hang in that air for longer. So it becomes also a route of transmission. Just to highlight what I've been talking about, and this is based on some scientific research. It depends when we talk, for example, as I'm talking, the amount of, can you say, invisible droplet infection is very minimal. But if I was going to sneeze, or if I've got an infection, it means the amount of virus which is coming out of me becomes greater. And it depends with what, if I'm just talking maybe in a quiet manner like I'm doing, maybe just travels the distance of a meter or so. But when I start singing, when I start sneezing and coughing, we are not talking of 2 meters, even up to 18 meters when we now include those aerosol generating procedures I'm talking about. And what are these symptoms? Like I say, most of this information, I think we have been saturated with it, but there's no harm in repeating it again. Signs and symptoms include sneezing in some patients, headache, cough. When it started early in December, I think those were the most common ones. Cough, sometimes a dry cough, and headache and shortness of breath. Especially shortness of breath, you'll find it a few days later as the complications arise, and also including the fever. But we know now there are other symptoms, and more research is done. Muscle aches. Some people just present with this vague muscle aches. They're not really explaining what is happening to them. Congestion or running nose. Like I said earlier, it was just to be assessed with a dry cough, but now you can even have a running nose, headaches. So sometimes you don't know whether it's just a headache, which is related to something, stress, migraine, or anything like that. It can be very confusing. Sore throat, loss of taste, becoming quite a common presenting symptoms in terms of the prevalence. And a lot of people actually, it may be the only presenting symptom. I've lost my taste, I can't smell anything. But they may not have any other symptoms. And like I said, it has been isolated, it's true, and it has also been seen also to cause diarrhea, and also fatigue and nausea and vomiting. Why do we worry so much about COVID? We worry because of its complications. It can cause acute respiratory failure, pneumonias. Some of it can respond to treatment, but some of it can be life-threatening. You can have what we call acute respiratory distress syndrome, which is the most feared one, and a number of people who end up in ICU is because they develop the acute respiratory distress syndrome. And again, with more and more research, it has been seen that things like acute, actually I would term it as a systemic disease. It's a virus which goes through the lungs, the most common site, but it ends up causing systemic effects, acute liver failure, cardiac injury, kidney injury, because septic shock, DIC, that is disseminated intravascular coagulation, and microclots, which can happen. In children also, like I said, there are no spares. There's some new phenomenon which you are seeing, this multi-system inflammatory syndrome, which are affecting the organs in the body. Rhabdomyolysis, which means the breakdown of muscles, and releasing toxins in the bloodstream. Can also develop secondary infections. And of course, the most feared one is death as a complication. That's why we really worry. You can see it's quite a systemic disease. So what are the risk factors? Things like age. The older you are, more risky it is for you to get COVID. You find that in the young people, you'll find that they may get it and they may be asymptomatic. But what is also interesting, as I will show in our profile here, we'll find that in Zimbabwe, the cases which are getting, some of them actually in the young age, if you compare to the European picture. Issue of race, ethnicity, more relevant maybe in countries in Europe, where it was found that in the blacks and minority, the side effects of COVID infection or the outcomes were much poorer as compared to the other races. The issue of gender, I also expand on that one. Some medical conditions, the comorbidities, which I mentioned earlier on, or use of certain medications can even worsen. I know there was so much hype. It is very interesting. I was talking to one of the pharmacists in the early days. There was, like I say, science is evolving. There was so much talk about quinine, chloroquine and so on. And I'm sure even here in Harare, most of the shelves in pharmacies were emptied by individuals. And some of them, unfortunately, and they even reported cases in countries like Nigeria, and I think even the States, some people ended up harming themselves with these medications. Some of them even creating more susceptibility to the COVID itself. Issue of poverty and crowding, I think we are all aware. And if you look at the scenario in South Africa, I'm not sure whether you can attribute issue of poverty and crowding. I think crowd, definitely we know, the world over, it's quite, because if you see the rise in the cases in South Africa, it's really, really difficult to explain from an African perspective. If you compare with other, why this big jump and rise? Maybe this issue of poverty and crowding may explain. Certain occupations can predispose, and worldwide, we know the health workers are the most at risk of this COVID-19. I mean, because of the nature of their work, in an environment where with 8 hours of your work, you're being continuously exposed to the risk of that infection. And also in women, pregnancy. So you need to have high vigilance. That's why I said it is also important for women to listen. And for their husbands who are listening, for the men who are listening, if they've got their wives or spouses or girlfriends, whatever, it's also good to take note of this. When we look at it started in China, let's just look at some key epidemiological insights from China. It teaches us a lot about this disease in terms of its behavior and what we should do. We know out of 100 people who get infected with COVID, 80% of them are mild to moderate, and some of them actually are symptomatic among those 80%. 15% will become severe. And out of that 15%, you find that maybe 4 to 5% become critical. Those are the ones which end up in ICU. In approximately 10 to 15% of the mild to moderate cases, they may become severe, and approximately 15 to 20 of the severe become critical. When you look at the average time from exposure to symptom onset, it's about 5 to 6 days. So you may be in contact with someone. Before, it was easy to do contact tracing, but now it's with this communal spread which is happening in our country. It's now very difficult really to trace, maybe it's so and so on. That's why I'm pretty sure even for the rapid response, it's becoming a challenge to do this contact tracing, because symptoms may come 5, 6 days later and you cannot really call. And for some of us in the health profession, you no longer know what is that patient on bed 10 or on this, because maybe that patient did not have any symptoms. Then from recovery, it's about 2 weeks. From symptoms to recovery, it's about 2 weeks. Then from symptoms recovery, for severe cases, it's about 3 to 6 weeks. And from symptoms onset to death, it's about 1 to, I'll say 2 to 8 weeks. And like I earlier said, COVID-19 is less frequent in children than adults. Children tend to have milder disease in most of the cases. But when they do, they have that severe form, which I did mention earlier. This is just a global picture. You don't have to, for those who have got laptops, and you can see on my screens, I know some are watching from their laptops, you may not be able to visualize this. We are going into the area of interest. And when you look at the sex distribution, the one on the right is the yellow. Generally, you may say it's not a big difference in terms, but there's more affecting of the males, especially in age group, maybe except in the 85 age plus, where somehow it's affecting more the females. And even in the research which has been done, when you look at the mortality trends, the World Health Organization has reported that 63% of death related to COVID in Europe have been among men. That is very scary. And do we reflect on this as men? Even in the Chinese, when they did their research, more than 70% of those who died were men. It's really scary. It's unfortunate at the moment in Zimbabwe. I think our figures are around, I didn't see the figures today, but they were 28, 26 by the last time I checked. I don't have the sex distribution, but it will be interesting. I'll continue to pursue it with the relevant people at the ministry. But I'm not sure whether it will follow the normal trend. What has been interesting in Zimbabwe is that with the current figures we have, it's mainly seems like it's affecting more the woman, especially in the younger age group. And again, another screenshot just to show, and I won't bother you, but it's just to reinforce what I've been saying. When you look now at the mortality figures in almost every other countries, whether it's South Africa, Spain, it seems like it's the men who are dying more. Hence the need for me to bring the attention of the men with this COVID. This we forget. Like I mentioned for Zimbabwean statistics, this, I think it's about 3 days ago when our figures were still around 1,200. I know they've gone up. This was the sex distribution. So you can see below the age, unlike maybe in the other countries, below the age of 34 and below, you find that it's mostly the women who are more affected than the men. But as we go 35 and above, it seems like the men, their true colors are beginning to show. And the question may be why. And these are the emerging trends. Men are more at risk of worse outcomes and death, independent of the age. Despite the figures I'm showing you, especially in the Zimbabwe scenario, where maybe in less than 34, the women are more affected. But still, when you look at the deaths, you find that the men, even globally. So while males and females have the same prevalence of COVID, at an international level, male patients have a higher mortality. And the big question for me, and I'm pretty sure also for you, is why? Is it the sex? When we talk about the biology, there are some things which are emerging from research. When they are looking at this virus, there are certain what we call receptor signs, which they go, when they go into your body, whether it's through the nose or through the mouth, they go into the lungs, they bind to certain receptor sites, and these are called S2 or angiotensin converting enzyme 2 receptor sites. This is where it lands, and for those with the laptop, you can see on the right, it's self-explanatory. But if these receptors were not there, the virus will not be able to penetrate. But it lands, once it lands there, it can now go into your cell and start multiplying there. And what has been interesting is that there are levels higher in men as compared to men. This S2, again, it's related to the biology. And there is an abundance of these S inhibitors in the lungs. Although now there is some which is found in the heart. That's why the virus also affects the heart, in the kidneys, and so on. But the preponderance of it is found in the lungs. So maybe this is why it is the more poor outcomes in male than in women. And when you look at the issue of gender, when we talk about gender, we're not, again, I've already talked about the sex, but we're talking of the roles which determine a person's risk to environments and the product that may be unhealthy. E.g., for example, you find that, and I'll show this on the slides, in studies done in 2017 with the WHO, more men smoke than women. I don't know whether you agree with me. When we have panel discussions, I would want to hear some comments. Men drink more than women in terms of number, or in terms of occupations. More men tend to take more risky occupations, maybe except for health, because generally the world over, you find that there are more and more women who are taking over the role of health. Maybe that's why when you really take a cohort of health professionals, you'll find that maybe it's the women who are dying more than the men, because they're working in this risk environment. And also issue of gender influence our health-seeking behavior. And in my last presentation, I think it was last year or last 2 years, we talked about the health-seeking behavior about men. It's so poor. Men only go to hospital when it's really, really bad, unlike women. What are we going to do about it? Just to reinforce what I was talking about, the issue of gender. This is a study done in 2015, sorry. The blue represents men in terms of smoking. More than 30% of the study population. In female, it was only 2%. Again, when we look at alcohol consumption, and this, remember, there are risk factors, not only for COVID, for any other diseases, cancers, among other diseases, which I'm not going to mention at the moment. Then also issue of genetics. Again, it has been shown, we all know that we have different genetics, which makes us male and others female. With females, it's XX. And I think even still when we were in secondary school, we used to be told, I think even early years of medical school, that females, biologically or physiologically, are stronger than males. I don't know what the other males who are listening to me, whether you say, but physiologically they're stronger because of those XX. Those genes are more protective than our Y. It makes us more susceptible at an immunity level. It makes us more susceptible to certain disease, or even when we fight those diseases. And also influence in terms of our hormone constituent. Like in females, you'll find that they have estrogens, progesterones, and which may be protective, and males with androgens. I know I'm running time, I'm about to. Then it has also been shown, like, for example, in terms of the sex difference, for example, if men get affected by lupus disease, they have poor outcomes as compared to female with the same type of disease. Again, issue of comorbidities, I've already mentioned here, ischemic heart disease. Again, if you look at it's more common in males. So what are the care and support we need to do for men, and think and reflect? Again, prevention. Daily self-risk assessments every day. Issue of, even as you leave your house, I always say, as an example, and I think someone was mentioning to me, when you're crossing a road, you look right and left, you look at right before you cross. You're doing a self-risk assessment. So please, on a daily basis, do that. Avoid crowds. Don't go to the supermarket when it's not necessary. And if you do, make sure that you're fully protected. Avoid enclosed spaces. We know COVID, like most viral infections, there's no treatment, but symptom support. Although most people, even my fellow health professionals, will not agree. What we are doing is palliation currently with whether you're taken to ICU or the treatment you're giving is just relieving pain and symptoms. So good diet. I know Dr. Austin is going to talk about the diet. Psychosocial support is very key. I'm reminded of one of our nurses, not our nurses, sorry, one of the nurses in one of the hospitals. When they became a contact, and she wanted to go home and isolate at home or quarantine at home, the husband says, "No, I don't want to see you here. A risk to my children." You can imagine the anger, the stigma which that nurse was going through, was coming to work for the family, but the husband did not want to see because he was afraid it was going to spread to the children and him. And that can also cause quite a lot of depression. Just to reinforce, and this is routine information, hand washing, etiquette, not coughing, social distancing. I cannot overemphasize this one. So what do we do when one is infected? There are many guidelines. It's a topic for another day, but you can see Minister of Health and we have got those guidelines. And those are my references for those who want to be academic and research. And I think Ali Hospice can share this presentation with you. Thank you very much.
Thank you very much to Dr. Chifamba. Thank you so much for that presentation. A lot of the things that are being said there, either as reminders or possibly hearing them for the first time. Nonetheless, no doubt we've got questions around COVID-19. Thank you so much to Dr. Dixon Chifamba of Island Hospice and Healthcare for that presentation. We will be hearing from Ratizai just now, Ratizai Moyo from Childline. But for now, it gives me great pleasure to thank the sponsors without whom this event would not be possible. And thank you so much to Zol Zimbabwe. They've assisted us with connectivity, the leading ISP in the country, and leading the way in terms of healthcare and assisting us as Island Hospice. And to Delta Corporation, thank you so much. Also, thank you to Schweppes Zimbabwe, Sovereign Health for coming on board, Area 46 and 263 chat. Thank you so much for your assistance. The team out there, Sir Nigel and your team, thank you so much for assisting us and supporting us through this. Right. It gives me great pleasure to call upon Ratizai Moyo of Childline Zimbabwe. Now, Ratizai is a program development and support manager working for Childline Zimbabwe, one of the leading organizations that supports child protection, prevention, and response intervention. Ratizai is a registered social worker with over 15 years work experience. She has been instrumental in developing the case management buddying system that twins government's probation workers and CSO social workers in responding to child protection violence. At a regional level, Ratizai has contributed to the development of the International Child Helpline Case Management Standards of Operations, the SOPs, for managing cases reported through the child helplines. She has spearheaded high-level research on social norms that are drivers of violence and contributed to the design of adolescent peer-to-peer programming using evidence generated from research. Most recent, she has supported the completion of the Intimate Partner Violence Study as part of promoting knowledge on violence, pioneering innovative work on cyber and online safety of children. She has a master's in child rights and childhood studies. Her research passion also includes corporal punishment, child discipline, and exploring alternatives to corporal punishment. Ladies and gentlemen, help me welcome Ratizai Moyo of Childline Zimbabwe. She will be treating the subject child abuse and child protection during COVID-19 lockdown. Ratizai.
Thank you so much. Childline is, we operate a 24-hour helpline service that where children and young people can call and talk to us about, since the lockdown in April, we have been receiving calls regarding children asking us what COVID is about. They've been asking if, suppose schools open, what will be put in place to make sure that they are safe from COVID. They've been asking about why the COVID messages are not specific to what children should do to keep safe. In a month, we receive about 50,000 calls coming in every month. However, in the COVID period, we have seen an upsurge of calls, up to 97,000 calls coming in some months. What we do is, as Childline, we operate in 4 thematic areas, one being where we are providing our safe and confidential reporting mechanisms. And then we have got our therapeutic services where we provide the counseling and the therapeutic support services to children. Then we have a knowledge management unit where we try to analyze what is happening, where is it happening, what abuse is rampant at this time, so that we are able to constantly be giving children updates on changes and to design programs that will respond to the needs of children as we find them. We also have an advocacy unit, which is quite new for us, but we have been doing it for a while. But I think only this year we made it more pronounced, where we try to advocate for the rights of children in many sectors. And we're looking at it and trying to see how we can influence our Zimbabwe to be passionate about the protection of children. What we know so far about child abuse, we know that over 3.3 million cases of child abuse are reported on a daily basis worldwide. We know that globally, more than 5 children die as a result of severe or extreme child abuse. We also know that 33% of girls in Zimbabwe will experience sexual violence before their 18th birthday. According to the Zimbabwe Republic Police, about 100 girls are sexually abused each day. And this is in normal environments and not in lockdown. In 2017, 44% of the cases reported through the 116 free phone were about child abuse. In 2019, 52% were about child abuse. So you can imagine how we are constantly increasing violence against children. Girls are more likely to be sexually abused, while boys are more likely to be physically abused. We have also noted that there is a link between child neglect, and violence against children. We're not sure how this happens, but there is a direct link. We've also seen that males are often the perpetrators of sexual violence, while women are perpetrators of physical violence. So let's talk about the dad, because this is a man's in bed. Half the time as dads, you come home and you have to deal with some discipline issues that have happened while you were away. Maybe you were at work and you come in and you get reports, your child did this and they did that and they did this. And then you become the disciplinarian and you discipline your child for mistakes that happened while you were not even there. What your child then learns is that you're the monster at home and mom is the perfect one. And you're being used to be the monster. So maybe as fathers, you may want to think again about how you can be a fun dad, but still be a disciplinarian in your home. What else do we know about child abuse? We know that 80% of children who die from child abuse are aged 4 and below. Why is this? This is because at below 4, there are a lot of things that happen to young children. Sometimes they're being toilet trained and whoever is toilet training them gets frustrated and takes it out on the kid. Sometimes they just cry uncontrollably and caregivers get frustrated. Or sometimes they're just a little nuisance because they are the crazy twos, they are the 3-year-olds, they're the 4-year-olds, and people just get frustrated and they beat them up thoroughly. And they sometimes, most times, 80% of them die from physical abuse. We have had incidences of children who have had their winkies tied up in rope so that they don't pee on themselves. We have had children who have been made to eat their own feces, and these are children who are aged below 4. The strange bit is that these age group of children rarely have access to reporting. So it's dependent on neighbors and some people in the family who can come and report on behalf of these children. We also know that 90% of abused children know their abuser. So there's a study that UNICEF did a while back, and they saw that abusers are familiar faces. It's people that children know. And these are your family members, the teachers, neighbors, etc. And 75% of abuse happens within a child's home. And this is for all types of abuse. More than 60% of child abuse cases are never reported, and only about a third of abused children receive help. When you look at it, also, we did a study a few years back, and we found that children disclose violence to other children. And how they have been treated when they disclose violence will influence whether they are going to tell anybody else or not. I'm seeing that the video here is not moving, so I'll continue with mine. We also know that there is a lot of online violence happening with children. Here we'll talk about how Zimbabwe in the last few years has experienced about 90% mobile penetration in the country. And following this, you will find that almost every household has got a phone. You will find about 15 kids sharing one mobile device. And in this, as they're doing that, they also have got free Wi-Fi zones that have increased from the 793 Wi-Fi zones that we had in 2016 to having much more. We now have Wi-Fi in public transport. We now have Wi-Fi in public areas, and there's a lot of access to internet now for children. I don't know if I should continue or should wait for the screen, or do I go on?
Okay, is the presentation being managed remotely?
Yes, we are going to, the computer which was using the remote is stuck, so I'm putting it on my laptop shortly.
Okay,
presenting
great. Okay, awesome.
Oh, great. So with the whole increase in free Wi-Fi areas, we have also seen that children now are much, much more exposed to online violence than previously before. It was never an issue, I think, as I was growing up. We never had to talk about how you can be violated online. But now it has become more topical. And worse now with the lockdown. We're having a lot of children, they're not in school, so they're spending their time clicking, surfing, viewing, liking, sharing, befriending, and following. And we also know that predators and pedophiles also hang out on the internet looking for their victims, and that's where they are. We have also been told by the ZRP that about 70% of the mobile data that is consumed in Zimbabwe is consumed on pornographic content, and it is by adults. So you can imagine, if I like to watch pornographic content, that means my child is going to like it 5 times better than I. What we're saying basically is, whatever you're watching as a parent online, just know that your child is going to do it 5 times better than you, and you'll never catch them. With the lockdown, we have been just watching and seeing the cases that have been coming on online safety. And so far, we have received cases on revenge pornography. We have received cases on child porn being shared online. There are cases on cyberbullying, which has just become very cruel and very harsh on kids. They are threatened every day, they are harassed. There's a lot going on. We've also seen that there's also a new trend online. I think for those who grew up naughty boys at school, they used to hold a mirror under your skirt. Now there's a new trend which is called upskirting. So guys will put out their camera under a girl's skirt and then they take pictures. We also have got a case now that is in court in Zimbabwe. It happened on the 20th of February, where a guy upskirted a lady in a Zuko bus. So that's also things that are happening in our country, and worse with the lockdown. There's a lot of grooming happening online, children being sexually lured, just like how it happens in physical spaces where a predator will groom a child and lure them and until they eventually pounce on them. The same thing is happening online. A kid, there are some who are stealing identities, and they may start chatting with your child, pretending to be a child themselves, and they chat and chat and chat, and then eventually they then pounce on them by inviting them. Oh, well, send me your nudes today. Send me just a picture of your breast. Send me this. And they constantly send it. And then eventually, the guy then shows up and says, okay, so you need to come next door. If you don't come next door, I'm going to share these pictures with your family. So, and a kid has become lured. There's also fights happening. We have also seen videos of people mocking a child online. And we have also seen intentions to suicide videos and recording of intentions to suicide. So what do the numbers say for us? During the lockdown, we have been trying to share messages on online safety with about 41,000 children. These are receiving constant messages on how to keep safe. From the start of the lockdown, we have counseled about 252 children on online safety and online violence. We have received 69 cases on online violence, and these have been reported to the VF victim-friendly unit and have been followed up. We also have gone physically to some houses, about 9 of them so far. We have got a reporting portal that was set up in the country, an online reporting portal. This removes videos and content of sexual abuse and exploitation of children. So when it went live in February 2020, so far up to date, it has got 11 cases reported. You may say this is a small number, but we've got countries like Namibia who have had their reporting portal set up for years, and in a single year, they will receive 3 cases. We set up as Zimbabwe in February, and already we have 11 cases, which says a lot about online violence in our country. We also know that girls are most likely going to be affected by online violence more than boys. And when our children experience online violence, they will rarely report it because they think it is their fault. So the next slides really just go on and tell you about how children are calling the helpline and how they're reported. In June this year, I think we have answered 92,000 calls about children, and June has seen the peak of the calls that have come through into the helpline. We also have seen a lot of sexual violence cases coming up, June being having 321 sexual violence cases being reported through the helpline. We also have got the neglect cases also coming up, about 201. Emotional violence also coming, and with emotional violence, unfortunately, it usually accompanies physical abuse and sexual abuse as well. So, what are the child factors that expose children to being abused? This is a weird one, eh? So, birth order. You will find that first-born children and sometimes last-born children experience more abuse at home, physical abuse, because of where they are born. And sometimes we also have found that children who are born first have a secondary responsibility of taking care of their siblings. And in their taking care of their siblings, they may be prone to sexual violence. Let me give you an example. In Rusape, in rural Rusape, a mom said to her firstborn child, go pick up your sister from the preschool. She went, it's within their neighborhood. It's just like a 2-minute walk to the preschool. So she went to pick up her little sister, and on her way there, somebody waylaid her and he sexually abused her. She then got up and continued to go and pick up her sister. At the school, that's where they noticed that this kid had blood and she was crying and she was such a mess. They tried to go back to where it is that she had been attacked, but the guy had already disappeared. So that's why maybe sometimes we then talk about birth order making children prone to sexual violence. We know that a child gender is also another factor for abuse, just like how we've said girls are more prone to violence more than boys. Physical violence, it's more boys. Sexual violence, it's more girls. Age of a child is also a factor. The younger they are, they're more prone to physical violence. The older they are, they're more prone to sexual violence. 15-year-olds are one of the age groups that call us the most because they're exploring their sexuality and, hey, they just get themselves twisted with men who are just coming up to them. I'm not attacking men here, hey, but most of the perpetrators tend to be male. Children with difficult temperaments are also likely to be abused. Children with disabilities, children with behavioral disabilities, children who are chronically ill, and children who have a history of abuse. And worse now, so in the COVID period, which child is likely to be abused? It is that child who has been stuck at home for the past 3 months, and they'll be maybe stuck at home again for another 3 months. Why is it so? Parents have never had to take care of their children for longer than 3 months. It is only now in the COVID period that this has happened. So that's why we're also talking about it. So any child can be abused. Child abuse does not discriminate on basis of race, age, color, class, creed, or gender. Any kid can be abused. I had some quick pictures that I wanted you to see of how intense sometimes abuse is. I had a picture of a girl who took an egg. She boiled an egg while the mom was away, and when the mom got back, she decided to punish her. So the mom boiled an egg and made the child hold a hot egg. The picture that you just saw with the kid with the cut on his head, that child was beaten up so bad by his father, who happened to work out of the country, but he traveled to Zimbabwe on his break and came and beat up the kid thoroughly and flew back. So the good thing about police is they're able to track you, bring you back, and make you answer for your crime. What are the caregivers factors that contribute to child abuse? A lot of things, because we are parents. I think most of the people listening tonight are parents. If you've got anger difficulties, you're likely to abuse children. caregivers who are socially isolated. Think caregivers who have got personal distress, and now we've got lots of distress because of the lockdown, and we take it out on our children. Then we also have the parents who have got unrealistic expectations. They would expect a child who is 7-year-old to be able to do the Pythagoras theorem. You know, they should know it, and that's so unrealistic and so unfair. And you punish your kids if they don't do it. Busy parents are also likely to abuse their children. Why? Because they are so busy. They are busy, and they're doing a lot of things. So they have no time for their kids. They would rather let the TV groom their kids and bring them up. And when a child demands for attention, busy parents normally take it out on their kids. Parents with chronic illness, parents with poor parenting skills, young parents also are likely to abuse their children. Then also in households where there's domestic violence, there is likely to be violence against children. We also talk about those families where there are extramarital relations. There's likely to child abuse there. I'll tell you an interesting one. We had a kid who called the helpline and said, well, can you help me? I think my dad is having an affair. So we were like, that's a new one, hey? So how do you know that your dad is having an affair? Then the kid said, well, I know that from his job to our house is 11 kilometers. But now my dad does like 60 kilometers in one day, which then leaves my dad as an affair. And we called them in, the parents, and had a meeting, and we discovered that indeed the parents were talking about divorce and separation, and the father was now spending time elsewhere. So the kid had been correct in saying they're having an extramarital. So your kids will know. There are other parental factors, like where you have housing problems, or where you're in a blended family, or it's a child-headed household, or grandparent family, where you also find factors that contribute to violence against children. We also have the humanitarian emergencies, like the one we're currently in. I think currently the country has 3 emergencies running together. So we have got the COVID emergency running, we have got the cyclone, we're still recovering from it, and we have got a drought emergency. And all those emergencies also make it possible for children to be abused. So what are the protective factors? What can we do as fathers, as parents, to make sure that our children are safe from violence? It's to learn the skills. There are lots of ways we can learn parenting skills. I know most people, or most men, would say, well, I learned from my mom that if you're good enough, you'll be good enough into protection. Well, it worked then, it worked for you, but it did not work for the children. So yeah, beating up kids doesn't work for you. You need to engage, because the modern kid that you have now listens to you when you speak to them, and they use facts. They just don't use the statements that our parents used to us. So learn the caregiver skills, learn the parenting skills, so that you're able to parent a child who is 10 times better than you are, and 10 times smarter than you are. So we learn the skills. Joins the community support, because there is community support for families, but we don't want it. We've built our Jura walls, and we've got our electric gates, and we keep our neighbors out. So you never are part of the community, and the community around you never helps you in understanding the child you're bringing up. But we should at least try to be part of the community. If you need emotional or social support, get that wherever you need to get it. Families that need financial support should also access financial support, so that you do not take out any frustration financially. Find stable housing. Imagine when children have to be evicted from their home every now and then. They just become more vulnerable. So stable housing is also a protective factor for children. As much as possible, we encourage parents to take care of their own children. Don't let the grandmothers take care of your kids. They did their part with you. Now it's your turn to take care of your own. Some people are connected to their faith communities, and this helps. And if you're such a person who needs to be connected like that, you join a community so that you also have support for your own personal needs and you're better able to be a better parent. Also look at how you can make your home safe for your children. I would always laugh, when I would get visitors at home, I would be out of my room and let the visitors take my room so that I never have to displace my kids. And it's better for me to go and share a room with my children than for a stranger or a relative of mine to share a room with my kids. It's not, you're just not being safe with and then just a wholesome environment is what kids need. So just want to be happy with that. So this is the child abuse.
Rati, your sound has gone wonky again.
Yeah, so this is the child protection, the child abuse presentation. I hope you got it, and we will all do what we can to make sure children are safe. And the numbers are available for you to call, to send us a WhatsApp message or an email so that we are also able to support the children that need to be supported. Thank you so much. I think just to summarize it, it should never hurt to be a child. It should be fun to be a child. So as much as we can, we all have a responsibility to ensure that children are happy and they are safe wherever they are. Thank you so much.
Thank you so much, Rati, for that presentation. And as you can see, the child line numbers are up on the screen. The main one to remember is the free phone, which is 116. Call 116. So it's good to communicate that to children, whether they're directly in our household or to our relatives, and promote that number. Childline is there for the children, but more so even for the parents as well. It should be fun to be a child, as Rati surmised at the end of that presentation. Thank you so much, Rati, for that presentation. What I think we're going to do is, without further ado, call upon Dr. Austin Jeans, to give his presentation because we are fast running out of time. Now, Dr. Austin Jeans is a sports, exercise, and lifestyle medicine physician based in Harare. He's the medical director of Innovate Sport and Health and author of The Low Carb Companion, a book on healthy nutrition. And Dr. Austin Jeans will treat the subject, the importance of exercise and metabolic health in the midst of COVID-19. Now, to those who have been in the country for some time, you'll know that Dr. Austin Jeans is all but a legend when it comes to exercise, healthy living, and nutrition. So it's great to have him here. Thank you for spending this time with us, Doc. Over to you, Dr. Austin Jeans.
Thanks, Barry. It's going to get my... thanks very much indeed, and thanks to everyone for the invitation, Island Hospice and Mudiwa. We really appreciate the opportunity to be part of this. I think the more information that people have in Zimbabwe and elsewhere, then I think they are more empowered to take action to improve their lives. And what we're going to talk about is the importance of metabolic health within the context of COVID-19 that we've heard quite a lot about this evening. And I think what I will try and share with you is how important an area this is in people managing their health in this interesting time that we live in. So let's look at some of the relevant, the important thing is if we have a look at human evolutionary development from a metabolic point of view, for the vast majority of human history, we've been doing really well, specifically if we look at human shape. But in the last 40 years, humans have changed their shape dramatically in many countries around the world. And we've seen virtually, we talk about an epidemic of COVID-19, which is very recent, but there is actually an epidemic of obesity and associated problems around the world, and certainly in many of the first world countries. What's the relevance? Well, if we look at the context of the situation that we're in with COVID-19, the reality is what we've learned over the last couple of months that this epidemic has been around is that COVID-19, like a military sniper, targets people with very poor metabolic health. And as Dixon was saying, the watchword is comorbidities, and the vast majority of the comorbidities that are leading to people developing severe COVID disease, ending up requiring hospitalization and in intensive care, are people with predominantly metabolic diseases, which we are going to look at. And what we're talking about, people with obesity, cardiovascular disease, most notably high blood pressure, and also the disease of diabetes. And all of these comorbidities are very heavily represented within the international hospital and serious case statistics for COVID-19. I'll tell you that in the United Kingdom, more than 73% of hospital admissions were people who have metabolic syndrome, which is prediabetes associated with obesity. In the United States, more than 60% of their hospital admissions were associated with people suffering from obesity. And diabetes and obesity are very closely related, as are the cardiovascular diseases like high blood pressure and heart disease. They are all linked, as I'm going to show you. So I can't see anyone out there, but hopefully some of you are paying attention now, and I've got your attention, and that's really the point. So we know that 95% of obesity, 90% of type 2 diabetes, 80% of heart disease, 70% of cardiovascular deaths, and 50% of cancer mortality are all the result of lifestyle factors which influence this concept of metabolic health. So what is the situation with metabolic health? Well, I'm going to start with the end in mind. People who have good metabolic health are people who have good, healthy nutrition, and that is the bedrock, the very foundation of this important part of human health. Exercise, which I'm going to talk about, is important, and so are things like having enough sleep, low levels of stress, and we can add a bit of sunshine in there as well. Key take-home message: if our metabolism is abnormal, our health will be abnormal. And these conditions, as I mentioned, are all about abnormal metabolism. So type 2 diabetes, obesity, heart disease, and many types of cancer can be considered diseases of abnormal metabolism. And the key physiological, pathological problem of abnormal metabolism is something that we call insulin resistance. I'm sure most people are familiar with insulin, a hormone produced by the human pancreas that helps us to control our blood sugars. And when this very well balanced system in people with good health is upset and the body doesn't respond to the insulin that our body produces, we have insulin resistance. And so we can put in our diagram that insulin resistance is the primary metabolic disorder. It defines abnormal metabolic health, and it defines the vast majority of these lifestyle disease conditions. And insulin resistance is very closely tied to the total amount of sugar and refined carbohydrate foods that come in our diet into our systems on a daily, weekly, monthly, and annual basis. Way back in 1980, we were all advised to eat a lot more carbohydrates in our diets because we thought that if we cut some fats out, that would reduce heart disease in the world. That's all well and good if the type of carbohydrates that we were eating were healthy vegetables and unprocessed foods. But unfortunately, industry and human obsession, almost addiction, has meant that this has been corrupted into a message that carbohydrates that we are consuming are mostly sugary processed carbs, sugary drinks, and all the things you can see on the screen. What do these sugary and highly processed carbohydrate foods do? And this is a picture of cereal and what it does to our blood sugar. So what most people are doing is that they're simply having very high levels of blood sugar repeatedly up and down through the day with the type of foods that they are eating. If you look at this graph and compare what an egg does to our blood sugar, which is the green line, you'll see that it hardly does anything at all. In the context of COVID-19, and Dixon mentioned a couple of these things, the one thing we do know is that associated with COVID-19 If you have elevated blood sugar, it more than doubles your risk of dying. And we know that from hospitalized patients, they present with elevated blood sugar. This might be partly a response to the infection. But anyone who has elevated blood sugars because of the way they're eating and their state of metabolic health, this is a very dangerous situation for anyone who contracts COVID-19 infection. I can summarize this metabolic disorder in this diagram. Insulin resistance is the primary metabolic problem. It comes about because we have too much sugar in our diet. That means we have too much insulin floating around the system, which the body eventually stops responding to. And then basically we get fatter and fatter, and that fat predominates in the belly, what we call belly fat, and it fills our livers up with fat. And when that's been going on for several years, even decades, we start to see the diseases that come out as a result of this process: obesity, diabetes, heart disease, and cancer, as I mentioned earlier. And if we look at some countries, these are good statistics from the United States, you'll see that if you plot their obesity statistics from about 1980, when people started to eat a hell of a lot more carbohydrate and a lot more of it became processed, that their obesity went up on a dramatic curve until now in the USA. Over 42% of Americans are obese, and look at how hard the Americans are being hit with COVID-19. And if you plot diabetes as a disease about 14 or 15 years after you see people fattening, you see that the diabetes rates in countries all over the world starts to go up. These have very close relationships to what people are eating. Even the WHO in 2015 came out making a statement about how much sugar is too much for humans to eat when we look at the abnormal health that can be a result of that. And they basically said that if adults consume more than 6 teaspoons of sugar a day, and if children eat more than 3, then that is associated in the long run with poor metabolic health and diseases. And just to give you some context to that, just think of a normal can of soft drink. I won't mention any brand names, but a normal can of soft drink contains 10 teaspoons of sugar, very easy to drink on a hot October day in Zimbabwe. So we can summarize the role of a healthy diet, which I'll say something about just now, is that if we reduce the sugar, it means that we have lower levels of insulin. Instead of being insulin resistant, the body becomes insulin sensitive. Fat disappears from the belly and from our livers. And the bottom line is we start to reverse metabolic disorder and restore metabolic order. And that requires a diet that is low in sugar and low in sugary processed foods. So that's the nutrition side of things in a nutshell. What about the role of exercise? Barry mentioned I was going to talk about this, and I'll say a few things about exercise. Most people think that the role of exercise, especially if you're trying to control weight, is simply about running off the kilometers and burning off the calories. So if you've gone out and had a nice packet of takeaway fast food chips, if you go and run 6 kilometers, you'll burn off those calories and everything will be fine. If you drink a soft drink and if you go and run for 2 kilometers, you're going to burn off those calories and all will be fine. And the answer is that true? And the answer is it's absolutely not true. If we look at long-term studies of using exercise for weight loss, if you follow people for up to 2 years, we find that over 98% of them fail to achieve a sustainable loss of weight. If they lose some in the short term, they pretty much gained it all back by the long term. And we have this nice little saying in metabolic medicine, you can't outrun a bad diet. I think one of the most profound statements that people need to understand. So bottom line is you have to fix the diet, get the nutrition right, and then start the exercise, and the two together will be the most substantial lifestyle interventions that will improve metabolic health. It doesn't really matter whether the exercise is running, walking, or cycling, or swimming, cardiovascular exercise, or resistance training, strength training, and ideally a combination of those two is best. What does it do? Primarily, exercise provides us with healthy muscles. If we've got healthy muscles, we have a state of the body which is very sensitive to insulin, which is the opposite of the insulin resistance we talked about earlier. And when your muscles are very insulin sensitive, they are very efficient at burning sugar and burning fat. Exercise also sustains very healthy blood vessels, and healthy arteries mean we have a healthy circulation in all of our organs, and predominantly the one that we're most concerned about is a healthy heart. Do we need to exercise for hours, for days? Do we need to be an Olympic athlete in order to be healthy? Absolutely not. We know from the American College of Sports Medicine research that you only need to accumulate 30 minutes of exercise daily. And you can break that up to 3 little 10-minute sessions. So that's not a lot. That's not a big ask for people to do. So in summary, if we don't want to be a target for the sniper COVID-19, we need to make sure that our metabolic health is at a very good level, because this disease, as I said, targets people with poor metabolic health and becomes thereby a dangerous condition. How important are all these factors in maintaining our metabolic health? Very important. And in fact, nutrition, which I mentioned is the foundation, is probably the 80% factor in sustaining and maintaining our metabolic health. So, in conclusion, 2 things we need to do to be metabolically healthy and stave off the risk of serious COVID-19 disease. We don't want to be an unnecessary target. 1, keep calm and eat real food. That's the message. Eat real food, not sugary, processed junk food. Secondly, do some exercise. I love this little cartoon. What fits your busy schedule better, exercising half an hour a day or being dead 24 hours a day? I think we all know the answer to that one. Well, I'm sure we're all familiar with the concept of flattening the curve. We've heard it many, many times. We're locking down. We're doing the things we're doing at public health level to protect our healthcare facilities from a sudden surge in serious COVID-19 cases. Well, there's another curve that we need to concentrate on flattening. In metabolic terms, we need to flatten that curve, and then we will have less people becoming seriously ill or at risk of becoming seriously ill. And if people take the right measures and eat better and exercise more, we know that you can reverse the metabolic consequences of poor nutrition and poor exercise in as little as 7 days to 2 to 3 weeks. So if people improve what they eat and improve the way that they exercise, they can really make a head start on staying ahead of this virus. Thank you very much indeed, and I think I'm 10 seconds short of my 15 minutes.
Well done. Thanks, Dr. Austin Jeans. Thanks, Austin. That was fantastic. So the key is a good diet that will ultimately result in us living a healthier lifestyle. So don't forget, we are taking your questions. We have seen a couple that have come through, and we're going to ask them to our panelists. We're going to dive straight into that right away. And the first question is for Rati. It's from Daniel McKenzie, and it says this: as this Zoom is mainly for men, what direct, hard-hitting messages do you have for fathers who are listening during this COVID-19 new norm in terms of our relationship with our children, as we might be abusing them without knowing it? Rati.
Hi. So,
Hi, Rati.
yeah, okay. That's a hard one, hey? That's a hard. You know what? With child protection, the only person you can trust is really yourself. And as a parent, as a father, you most probably know exactly what you need to do to make sure your children are safe. So how do you know you're not abusing them during this COVID time? Well, at least spend time with them, get to know them, ask them what are they doing online, and take part in it. Say to them, wow, why don't I spend 20 minutes with you? Go on a date with them at home, for the next 1 hour, it's your time, and I'll do what you like, and I'll listen to your stories, and I'll play your games, so that at least you get to know them. And the lockdown is a good time to get to know your kids. Well, all I can tell you is get to know your kids. They will tell you what they need from you, and they are your best teacher. Learn from them.
Rati, as a follow-on to that, with the lockdown has come the possibility of very strained relationships with our children, in the sense that right now a lot of the schoolwork is being done at home, and parents aren't used to that. They've got their own work because they're working from home, and then they've got to do the schoolwork. Perhaps talk to the issue of striking a balance in terms of discipline, speaking sternly so the children do what they ought to do at the time that they ought to, and abuse.
And the stress.
Yes.
Yes, and the stress. So as much as you're anxious about COVID, your kids are anxious too. Worse, they're anxious because they also don't have access to their friends and their school, and the schoolwork is being brought at home. I also heard another school that has even given the exams so that they do their media exams at home. So this is also a stress. And the parent is not a teacher. Hey, you're a parent. And you have to be the teacher, you have to be the mom, you have to be the cook, you have to be the dad, you have to be the provider. So it's also added stress on you, and I do understand. So what you can do is to talk about it together. So you sit with your children and say, well, this is what is happening. This is what COVID means. And this is what it has changed in our lives. How can we rearrange our lives so that we all live together 24 hours as we are expected to in the lockdown? And they will tell you what to do. You will have also some free time where everybody goes into their own space and you are also able to work by yourself. But it's about negotiating it and discussing it and agreeing with your children. Don't impose, because they are highly stressed. They're even more stressed than you are. So talk to them and listen, and let them also have time to play. We're bringing out a safe play card soon. I think in the next week we'll be sharing on Facebook so that parents access it, where we're giving some games that you can give to your children so that they can play with no touch and no contact, just for us to just get parents also to get a break. But do talk to them. They will guide you. Thank you.
Brilliant. Thanks, Rati. Paul Davis says, outstanding presentation by Austin and very humbling presentation by Childline. So thanks very much to our panelists for your presentations. This question is from Daniel McKenzie again. It's to Austin, and it says, during lockdown, please talk about smoking and alcohol, as the temptation is higher because we are mostly working from home. Please advise.
Well, from a general health perspective, smoking too much and drinking too much not bad for your health is bad for your health anyway. What's really interesting within the context of COVID-19 is that smoking has not been shown to be a high risk factor for severe disease. In fact, there are some studies to suggest that smokers have a reduced risk of severe disease, and that's an anomaly that we can't explain. It may actually point to or speak to what I was talking about, that metabolic health appears to be the primary target for this disease. Because if you look at everybody's figures from the UK to the States to Europe, people with metabolic diseases feature highly in the hospitalization and the deaths. People who smoke don't. So it may simply not be a mechanism within the lungs that smoking has a negative effect on. Alcohol, at the end of the day, the issue with alcohol, and obviously our neighbors in South Africa have had their alcohol ban, which was then lifted and it's gone back. The problem with alcohol is it increases the chances of risky behavior. It doesn't have a direct effect in the COVID-19 context, but I read in South Africa, by banning alcohol, they reduced hospital casualty and ward admissions by something like 4,000 patients a week. So the South Africans have been doing it as a survival strategy to sustain hospital capacity for COVID-19 patients, which is interesting. So I don't know that we have, again, it's not my area, and Dixon might have more on that. I don't know what our alcohol-related hospital admissions are in terms of trauma, because that's what it's about, risky behavior and driving, risky behavior and violence. But that's really the context of alcohol. As I say, for smoking is not good for you, but it doesn't really at this point seem to have a huge presence in terms of COVID-19.
Perhaps a follow-on to you, Dixon, is around hospitalization. I know you gave us some figures, facts and figures about how the disease is operating in other environments. What sort of percentage of those that are positive are actually going through to hospitalization, just as an average?
Yeah, I mean, when you're looking at our local figures at the moment, I think because of the overwhelmingness of the situation, we don't have figures. It's difficult to get. I think they are there, but they've not been collated so that I can give you the exact numbers. But I know a lot of people who have got mild to moderate are being taken care of home.
Okay. Okay.
Yes, I was saying he has got a point there. Looking at our figures vis-a-vis our population, someone would ask, have we tested enough? Is this a biased sample where we are maybe excluding those people coming from quarantine, whom are going mandatory testing? What about the rest of the population? Or we are picking those who really are coming with symptoms? We may not really have a picture. So from a biostatistics perspective, it may not reflect the true picture in the country. So it's difficult to really comment with the absolute epidemiological backing of those figures.
Okay. Okay. There was one for Rati, which spoke to the element. It's from Mike Mue, and he says the issue, Rati, of fathers bathing girl children without feeling a bit unsettled about it.
Okay. So, yeah, mothers can bath their children. Fathers can bath their children. The thing that we need to do is, from an early age, we start teaching our children about their body, their rights, safe touch, bad touch. We start teaching our children early on to start bathing themselves, so that by the time your child is 3, they can basically bath themselves. When your child is 7, I would want to see a dad who can walk in on a 7-year-old and they would let him in, because after the age of 7, once they're friends, your kid doesn't want you close to their body. So start an early age, and then you're out. Yeah.
Right.
By 3, they should at least know. By 5, they can safely bath themselves and talk to them as you do.
Right. Okay, thanks, Rati. Well answered. Alex Magroshe has this to say. It's for you, Austin. It says, what exercises, and I fear I know the question. I know the answer to this question, but what exercises can one do daily to manage belly fat?
Okay, so key point is I never try and tell people to exercise off their belly fat. I think I made that quite clear. At the end of the day, exercise, you'll never achieve any sustainable weight loss unless it's combined with healthy eating. So if you've ticked the box of healthy eating, then once you've reestablished a better or improved, more normal metabolism and you're able to burn that belly fat, then at the end of the day, any exercise is beneficial. So if you're doing resistance muscle training, then you're building bigger muscles, which means your engine is bigger and you can burn more fuel. And you can then translate that into longer runs or longer walks or longer rows or longer swims or longer bikes, which means you can burn more fat going forward over time. So at the end of the day, there is no one exercise which is the best. A combination of cardio exercise and resistance training is always the best combination, but you're not going to burn much fuel if your nutrition is poor. So those last 2 slides were the key. Get your diet right, then get your exercise going. And it doesn't really matter whether you concentrate on cardio with a bit of resistance or you do more resistance and some cardio, you will eventually burn off that belly fat. It goes quite easily.
Brilliant. Goes quite easily is the word that every man wants to hear. But those that have been trying, it isn't happening easily at all, and I'm sure it's linked to the diet and nutrition. So change what you eat and should be. And the drinking, yes, and let's not forget the drinking at all. Okay, I'm going to wrap this one up in terms of our panel discussion, and call upon Mudio Mundawara, the Executive Director of Island Hospice and Healthcare, to give us some closing remarks and a small vote of thanks. Mudiwa.
Thank you very much, Barry. I don't have any remarks other than just to thank everybody. I want to start first by thanking our speakers, Texan Chifamba, Ratidzai Moyo, and Austin Jeans. Thank you all for very interesting subjects. I suspect that we could have gone on all night, with the subject matter, but that simply is not possible. So I want to thank all of them. I want to thank our team at Island, Wendy Zakawapano, Dorothy Mucho, Darlington Shoniwa. They're the ones who helped put this. And I also want to thank you, Barry, for taking us very ably through this evening. You are, I think that you've got this job for life. You did it before, you're going to do it. And I think that really you'll do it again next year. Okay, and then finally, I just want to thank all of our participants, everyone who joined us today. Thank you very much. Through your support of Island, both materially and morally, we are able to continue doing what we do. It's good for us to see you even supporting events such as this. So we want to thank you all. And just say to you, well, hopefully next year, we won't have all these hassles and we'll be able to meet face to face and have a healthy, some healthy snacks, Austin, and maybe one or two drinks at that stage. All right, so I just want to say to everybody, in the meantime, please stay warm and stay safe. Thank you very much, everybody. Thank you, Barry. Thank you, our speakers. Everybody have a good night.
Thanks very much to the team at Island. Thank you so much to Mudiwa. Thank you so much for ably leading us. Every single year we're able to convene, but beyond that, there's work that happens between these meetings. It's not about these meetings, and it's thanks to the team at Island who continue to work tirelessly in the background. We appreciate it. Everybody, thanks for being here, and we'll see you next year. Good night.